How to treat and cure gout. Gout is a painful, arthritic condition of the joints. It usually strikes the big toes, but it can also affect the ankles, heels, knees, wrists, fingers and elbows. The symptoms of gout. The pain associated with gout is often sudden and intense. Joints tend to swell, and can be warm to the touch. The skin around the joint may also take on a deep red or purple hue. People who have had gout for extended periods of time may develop nodules beneath the skin near joints. These are accumulations of uric acid crystals. Attacks can recur in the same joint over weeks, months or years, and repeated bouts of gout can damage the joint. Kidney damage can also occur. The causes of gout. Gout has a strong genetic component. The hallmark of gout is elevated blood levels of uric acid, a breakdown product of protein metabolism. Uric acid comes from the metabolism of purines, a subclass of proteins that are abundant in human tissues and such foods as organ meats, sardines, anchovies, mushrooms, asparagus and lentils. Also, a number of drugs and supplements can increase uric acid levels in the blood and its tendency to form irritating crystals in joints. These include salicylates, vitamin B3, excess vitamin C and diuretics that may be prescribed for high blood pressure, edema or cardiovascular disease. Others are cyclosporine and levodopa for Parkinson's disease. Excess alcohol consumption, being overweight, and exposure to lead in the environment also increase the risk of gout in genetically susceptible individuals. Other risk factors include dehydration and acid conditions of the blood that can result from serious infections, surgery or ketogenic weight loss diets. The genetic component should not be underestimated, however. It is possible to have high levels of uric acid and never develop gout. Treatment for gout usually involves medications. What medications you and your doctor choose will be based on your current health and your own preferences. Gout medications can be used to treat acute attacks and prevent future attacks as well as reduce your risk of complications from gout, such as the development of toffee from urate crystal deposits. Medications to treat gout attacks. Your doctor may prescribe a higher dose to stop an acute attack, followed by a lower daily dose to prevent future attacks. NSAIDs carry risks of stomach pain, bleeding and ulcers. Colchicine. Your doctor may recommend colchicine, a type of pain reliever that effectively reduces gout pain. The drug's effectiveness is offset in most cases, however, by intolerable side effects, such as nausea, vomiting and diarrhea. After an acute gout attack resolves, your doctor may prescribe a low daily dose of colchicine to prevent future attacks. Corticosteroids. Corticosteroid medications, such as the drug prednisone, may control gout inflammation and pain. Corticosteroids may be administered in pill form, or they can be injected into your joint. Corticosteroids are generally reserved for people who can't take either NSAIDs or colchicine. Side effects of corticosteroids may include mood changes, increased blood sugar levels and elevated blood pressure. Medications to prevent gout complications. If you experience several gout attacks each year or if your gout attacks are less frequent but particularly painful, your doctor may recommend medication to reduce your risk of gout-related complications. Options include medications that block uric acid production. Drugs called xanthine oxidase inhibitors limit the amount of uric acid your body makes. This may lower your blood's uric acid level and reduce your risk of gout. Side effects of allopurinol include a rash and low blood counts. Febuxostat side effects include rash, nausea and reduced liver function. Medication that improves uric acid removal. Probenecid improves your kidney's ability to remove uric acid from your body. This may lower your uric acid levels and reduce your risk of gout, but the level of uric acid in your urine is increased. Side effects include a rash, stomach pain and kidney stones. Medications are the most proven, effective way to treat gout symptoms. However, Making certain lifestyle changes also may help, such as limiting alcoholic beverages and drinks sweetened with fruit sugar, fructose. Instead, drink plenty of non-alcoholic beverages, especially water. Limit intake of foods high in purines, such as red meat, organ meats and seafood. Exercising regularly and losing weight. Keeping your body at a healthy weight reduces your risk of gout. If gout treatments aren't working as well as you'd hoped, you may be interested in trying an alternative approach. Before trying such a treatment on your own, talk with your doctor to weigh the benefits and risks and learn whether the treatment might interfere with your gout medication. Because there isn't a lot of research on alternative therapies for gout, in some cases the risks aren't known. Certain foods have been studied for their potential to lower uric acid levels, including coffee. Studies have found an association between coffee drinking, both regular and decaffeinated coffee, and lower uric acid levels, though no study has demonstrated how or why coffee may have such an effect. The available evidence isn't enough to encourage non-coffee drinkers to start, but it may give researchers clues to new ways of treating gout in the future. Vitamin C supplements containing vitamin C may reduce the levels of uric acid in your blood. However, no studies have demonstrated that vitamin C affects the frequency or severity of gout attacks. Talk to your doctor about what a reasonable dose of vitamin C may be. And don't forget that you can increase your vitamin C intake by eating more vegetables and fruits, especially oranges. Cherries. Cherries have been associated with lower levels of uric acid in studies, as well as a reduced number of gout attacks. Eating more cherries and drinking cherry extract may be a safe way to supplement your gout treatment, but discuss it with your doctor first. Other complementary and alternative medicine treatments may help you cope until your gout pain subsides or your medications take effect. For instance, relaxation techniques, such as deep breathing exercises and meditation, may help take your mind off your pain. During symptom-free periods, these dietary guidelines may help protect against future gout attacks. Keep your fluid intake high. Stay well hydrated, including plenty of water. Limit how many sweetened beverages you drink, especially those sweetened with high fructose corn syrup. Limit or avoid alcohol. Talk with your doctor about whether any amount or type of alcohol is safe for you. Recent evidence suggests that beer may be particularly likely to increase the risk of gout symptoms, especially in men. Get your protein from low-fat dairy products. Low-fat dairy products may actually have a protective effect against gout, so these are your best bet protein sources. Limit your intake of meat, fish and poultry. A small amount may be tolerable, but pay close attention to what types, and how much, seem to cause problems for you. Maintain a desirable body weight. Choose portions that allow you to maintain a healthy weight. Losing weight may decrease uric acid levels in your body. But avoid fasting or rapid weight loss, since doing so may temporarily raise uric acid levels.